Services. We do have a jam-packed agenda today, and I believe we are ready to go ahead and get started. Madam Secretary, please take the roll.
Representative Bentley? Here in the room. Representative Bowling? Representative Bray?
Present in the room.
Representative Birch? Present. Representative Dotson?
Present.
Representative Elliott? Representative Fleming? Present. Representative Fraser Gordon?
Present.
Representative Marzian? Present. Representative Gibbons Prunty?
Here in the room.
Representative Rayburn? Here. Representative Raymond? Here. Representative Riley? Here. Representative Sharp? Representative Sheldon?
Here.
Representative Tate? Representative Weber? Here. Representative Westrom? Representative Wilner?
Here in the room.
Chairwoman Mosier?
I am here in the room. Okay, we have a quorum and are duly established to carry on with our business here. So I just want to make a quick announcement. We do have an overflow room in 171. It looks like some folks are taking advantage of that. I just want everyone to be comfortable because we're going to be here a while. Also, silence your phones and, just be courteous to your neighbors. We are going to go ahead and get started with Senate Bill 8. I believe that Senator Julie Rocky Adams is with us, and if you have any guests, please introduce yourselves for the record and proceed, and be safe down there.
Hi, I'm Julie Rocky Adams, State Senator from District 36, and I do have a couple of people with me here, but they said, we don't need to go to the table. We'll help you answer questions if we need to. And I'll try to be brief, but Senate Bill 8 is an act relating to child welfare, and child welfare belongs to all of us in this chamber, and we all play a role. And the purpose of this bill is to address Kentucky's state of child welfare matters and to purposefully and thoughtfully expand child abuse and neglect prevention services. So as we all know, Kentucky has led the nation in child abuse and neglect for 3 consecutive years. And the General Assembly has made great strides in legislating foster care, adoption, and prevention over the last several years. But really our approach has been piecemeal in a lot of these areas. So what this bill is designed to do, it's designed to take a comprehensive look at our child welfare, our structure, our statutes, and our regulations. So we all are familiar with the pressures on DCBS and our social workers. Senate Bill 8 has been crafted as a policy document to primarily address child welfare policies and practices that will also complement the much-needed financial investments in our social workers and our prevention services. So Senate Bill 8 has been designed in a manner that should unite all of us. We've gotten input from the Attorney General, the Cabinet for Health and Family Services, the Administrative Office of the Courts, child welfare providers, and our foster youth advocates.
Motion on the bill.
Okay, we have a motion and a second. That was so expedient and thorough. Thank you so much. Do we have any questions? Representative Prunty.
Thank you. I just was curious on page 10, the section that was added on the fictive kin definition. I was just curious about the fictive expansion of the fictive kin definition, why that was added.
So the fictive kin definition, we wanted to expand that, and this change, it was conforming with the same definition of change to fictive kin in Section 17. And so the Cabinet for Health and Family Services asked us to kind of mirror those in those 2 different sections.
Okay. We have adopted grandchildren, so I was just thinking about how that might relate. So I was just curious about that being added. But I'll ask someone else later. Thank you very much. Thank you.
But yeah, it's individual who has an emotionally significant relationship with the biological parent, sibling, half-sibling, and in the case of a child from birth to 1 year of age. So it's a little bit of an expansion.
Okay. All right. Well, thank you very much for bringing this bill. We always appreciate good updates to our child welfare system, and certainly this is a huge concern for all of us. So thank you for your work. I know that this is a big undertaking, and I appreciate all of the stakeholders' input as well. See no further questions. Madam Secretary, please take the roll.
Representative Bentley?
Aye.
Representative Bowling?
Yes.
Representative Bray? Representative Birch? Representative Dotson?
Yes.
Representative Elliott? Representative Fleming?
Quick comment, but I'm voting yes. I just wanted to express appreciation to the sponsor. I know you've been an advocate for child care, pregnancy of women in the prisons, and I think this is a very, very good, needed project. I look forward to helping those folks who or go under horrible situations to make sure they're better prepared. So thank you very much, Senator Adams.
Representative Frazier Gordon?
Yes.
Representative Marzian? Representative Gibbons Prunty?
Yes.
Representative Rayburn? Representative Raymond? Representative Riley? Representative Sharp? Representative Sheldon?
Yes.
Representative Tate? Representative Weber?
Yes.
Representative Westrom? Representative Wilner?
Yes.
Chairwoman Mosier?
Yes, ma'am. Okay, Senate Bill 8 passes with favorable expression. It was actually unanimous. I wish we had consent. We do not, but we will take good care of it on the House floor. Thank you very much. Okay, next we have Senate Bill 56. Senator Donald Douglas is with us, and I think that this is a very needed and quick fix, so please introduce yourself for the record. I don't see any guests, but if you have any, introduce them and proceed.
Thank you, Madam Chair. My name is Senator Don Douglas. I represent District 22, which includes Fayette County, Jessamine County, and Garrett counties. I do have with me today via Zoom Dr. Phil Skolnick. He is the Chief Scientific Officer of Opiant Pharmaceuticals, and if necessary, he'll be here to help answer any questions that you all may have. This bill is very limited in its scope. I'm simply changing some of the language in an existing statute. Senate Bill 56 is what I call the opiate antagonist bill. An opiate antagonist is a pharmacoactive preparation that is designed to reverse the effects of a drug overdose, even the deadly effects of an opiate overdose, whether you're in the hospital or whether you're in the community. This particular bill is designed to expand the language of an opiate antagonist to allow the inclusion of more newer reversal agents that are coming onto the market. This adjustment is really, really needed because we need to include these drugs in our pool that we can use on our patients as they have these issues. Now,
Motion on the bill.
Second.
Okay, thank you. We have a motion and a second. Do we have any questions? Representative Marzian.
Thank you, Madam Chair. Can you tell me what a few of the antagonists are, what the names of them are, and would that also then require our EMS or whoever to be carrying a whole array of medications?
We're not talking about a lot. Currently, in our statutes, it actually names naloxone as the drug. There are other drugs now coming onto the market, and when they are approved for use by the FDA, I wanted to be able to make sure that these drugs are able to be used. This is really a niche area. There are not a lot of companies that are working on a wide variety of opiate antagonist drugs. But given the issues that we've had with opiate overdoses, especially in the state of Kentucky, and being a physician, I wanted to be ahead of the curve.
Can I have one follow-up, please?
Yes.
Thank you, Madam Chair. Thank you for that. And do you happen to know the cost of these medications and what it would cost our EMSs to carry them?
No, Madam Representative, I do not at this time. Again, they're not on the market.
Thank you very much for that explanation. And I would just, for purposes of clarification, we don't typically name medications in statute, and I think this is a clarification to broaden the definition of naloxone, which is an opioid antagonist, to anything that might come on the market in the future. Is that correct?
Yes, Madam Chair.
Okay, thank you. Representative Bentley, do you have a question?
Yes, Chair Lady. Senator, what is agonist?
An opioid or an agonist drug in itself is a drug that actually enhances the response of a primary drug. We talk about an antagonist being something that opposes the drug. An agonist is something that enhances what we get out of a particular drug or a particular substance.
So an example of an agonist for this would be?
If we're looking at some of the opioids, one of the problems that we're having, or that's being had in pain management now, there is a particular anti-seizure medication, and I'll leave that medication unnamed right now. But what we found over the years, and I say we, not as in pharmacists and not as in practitioners, but I'm talking about people who've used it on the street, have found that there are other drugs that actually slow the metabolism of the opiate medication, and by doing that, it actually prolongs the half-life of that particular drug and allows that drug to have to seek a higher level in the bloodstream, and therefore it has more psychoactive effects. In other words, you use less of that drug and you'll get a higher high.
Thank you, Senator. Thank you, Chair Lady.
Okay, thank you. Seeing no further questions, we have a motion and a second on the bill. Madam Secretary, please take the roll.
Representative Bentley?
Aye.
Representative Bowling? Yes. Representative Bray? Aye. Representative Birch? Representative Dotson?
Yes.
Representative Elliott? Aye. Representative Fleming?
Yes.
Representative Frazier Gordon?
Yes.
Representative Marzian? Yes. Representative Gibbons Prunty?
Yes.
Representative Rayburn? Yes. Representative Raymond? Yes. Representative Riley? Yes. Representative Sharp? Representative Sheldon?
Yes.
Representative Tate? Representative Weber?
Yes.
Representative Westrom? Representative Wilner?
Yes.
Chairwoman Mosier?
Yes. Okay, Senate Bill 56 passes with favorable expression, and the same should pass on the House. Thank you very much for this update, and congratulations.
Thank you, Madam Chair, and thank you, committee.
Okay, next we will hear House Bill 157. If Representative Massey is with us, I know that you are helping with this bill and are between committees. He may not be here. Okay, so while we I think while we're waiting, I'll go ahead and quickly present HCR 112, and I'll just do it from here. It's actually quite simple. It seeks to establish a task force to complete studies on our healthcare worker shortage. We hear consistently that this is an ongoing issue, and we would like to, and we do have a committee sub. So yeah.
Second.
Thank you. All in favor of adopting the sub? Okay, thank you. Okay, thank you. So we have a motion and a second. And Representative Marzian, you have a question.
Thank you, Madam Chair. I think this is a great idea. And it seems like there can be a task force, or the issues can be assigned to an interim committee as well. Is that correct? Mm-hmm. Thank you, Madam Chair.
Yes, of course. Yes. Okay. Any further questions? Okay, seeing none. Madam Secretary, please take the roll.
Representative Bentley?
Aye.
Representative Bowling? Yes. Representative Bray? Yes. Representative Birch? Representative Dotson?
Yes.
Representative Elliott? Representative Fleming,
Aye.
Representative Frazier Gordon, Representative Marzian, Representative Gibbons Prunty,
Yes.
Representative Rayburn, Representative Raymond, Representative Riley, Representative Sharp, Representative Sheldon,
Yes.
Representative Tate, Representative Weber,
Yes.
Representative Westrom, Representative Wilner,
Yes.
Chairwoman Mosier.
Yes, ma'am. Awesome. Okay. House Concurrent Resolution 112 passes as amended by the committee sub with favorable expression. The same should pass on the House. Thank you. Okay. I think we're going to go ahead and call up House Bill 7. And I know that Representative Reed, Pro Tem Reed, and Speaker Osborne are here to discuss this important legislation. And if you have any guests, please introduce them. Otherwise, introduce yourselves for the record and please proceed. We do have a committee sub.
Thank you, Madam Chairman. I am David Meade, Speaker Pro Tem of the House, and I have David Osborne, Speaker of the House, with me as well today. And we do have a committee sub. I believe it is House Committee Substitute 2.
Motion.
Okay.
Second.
We have a motion and a second on House Committee Sub 2. All in favor?
Aye.
Any opposed? Okay, thank you.
Well, thank you, Madam Chair and members of the committee. This is a fairly lengthy bill, but it is not difficult to understand now as we have made some changes in it in this second committee substitute, but I will go through it section by section as quickly as possible. Section 1 is simply the definitions that are outlined for the next few sections of the bill. Section 2 requires the Cabinet to do yearly analysis of TANF, Temporary Assistance of Needy Families, block grants to determine if there are unobligated funds. If it is determined that there are unobligated funds, those funds will be used to assist in funding a new job placement program, which will be established in Section 18 of this bill, and additional work supports through KTAP, the Kentucky Transitional Assistance Program. Section 3 codifies federal law that restricts cash assistance from being spent in bars, adult entertainment facilities, casinos, on alcohol, tobacco, and lottery tickets in order to create penalties for violations of this section. The first violation would be for misuse of cash assistance, 1 month suspension of the assistance. Second violation for misuse of that would be 3 months, and the third violation would be a 5-year suspension. It restricts the use of electronic benefit cards to purchase necessary items for the welfare of the family, and requires the Cabinet to put multiple assistance programs on one card with a minimum of SNAP and Medicaid on the same card. Section 4, the General Assembly affirms the mission of SNAP and recommends that 75% of monthly benefits be used to purchase healthy foods and use the Kentucky Double Dollars program at farmers markets across the state. It also uses surplus SNAP education funds to expand access to farmers markets and enhancing the Double Dollars program and helping both those on assistance and our farmers. Section 5, establish a SNAP transitional benefit alternative to ensure families transitioning off TANF and KTAP can receive that extra 5 additional months of SNAP benefits. It requests a SNAP Elderly Simplified Application Project waiver to allow seniors and individuals with disabilities who receive SNAP to use a simplified application for their benefits and extend their enrollment in the program to 36 months in order to make the process easier on those seniors and disabled individuals. Waives the requirement for recertification interview for those seniors and disabled individuals. Requests a SNAP standard medical deduction waiver to allow seniors and individuals with disabilities a standard medical deduction on their income each year instead of having to itemize and claim medical deductions that are over $35. Individuals can choose to take the standard deduction or still itemize if they choose to do that. Reactivate SNAP work requirements for able-bodied adults with no dependents. Require SNAP households to comply with change reporting requirements, meaning changes in income must be reported within 10 days of the date that the change becomes known to the household. Currently, households only have to report income changes every 6 months to 1 year. Section 6 creates a community engagement requirement using currently established SNAP work requirements for able-bodied adults without dependents, requiring them to participate in at least 80 hours of qualifying activity each month, and that is in transitioning that over to Medicaid. The sixth section prohibits the Cabinet for Health and Family Services from establishing a basic health program without first obtaining an authorization from the General Assembly to do so. And Section 8 requires the Cabinet to conduct eligibility redeterminations in the normal course of business to compile a list of ineligible Medicaid recipients. When the federal government lifts what is called maintenance of effort restrictions, the Cabinet will immediately start removing ineligible recipients and will have 12 months to complete that process. Section 9 prohibits the Cabinet and Department of Medicaid Services from making presumptive eligibility determinations. Section 10 establishes the responsibilities of hospitals when making presumptive eligibility determinations. This is language that was given to us by the Kentucky Hospital Association. Section 11 requires the Cabinet to file for a waiver to allow Medicaid to be used for treatment of incarcerated individuals with substance use disorder. Section 12 permits a custodial parent who is disqualified receiving cash benefits for any reason to designate and to receive cash assistance, a designative to receive cash assistance on behalf of the child. Section 13 directs the Cabinet to coordinate with the Department of Correction to use Victim Information Notification Everyday Network in order to identify public assistance beneficiaries who have been incarcerated or released. This is language that came to us from the Jailers Association. Section 14 requires the Cabinet to update the Public Assistance Oversight Advisory Committee on implementation of this act. Section 15 authorizes the Attorney General to enforce this law when it is not followed by the Cabinet. Section 16 creates a job placement assistance program in the Education and Workforce Development Cabinet for able-bodied individuals enrolled in Medicaid. What this program will do will be working one-on-one for those able bodies. The Cabinet will give those names to Workforce Development. They will work one-on-one with them to place them in job positions where they will partner. That Cabinet will partner with businesses across this state to put those folks in a job placement. They will also put an emphasis on those employers who are offering health care benefits at the time. Section 17 reestablishes the Medicaid Oversight and Advisory Committee as the Public Assistance Oversight Advisory Committee that will provide oversight of the implementation of all matters relating to public assistance. This language may change in the Senate depending on what happens in the House with a bill that we have that will be reorganizing some of those committees. Section 18 requires the enrollment and benefit tracking agencies for Medicaid and SNAP to receive and review data from various sources that might indicate a change in eligibility for benefits. Those sources are the Department of Revenue, Administrative Office of the Courts, Kentucky Lottery Corporation, Office of Unemployment Insurance. Prohibits the Cabinet from applying for or renewing any waiver of SNAP work requirements unless the unemployment rate meets or exceeds 10%. The Cabinet determines if a specific county meets the requirements for the waiver, or the General Assembly authorizes the Cabinet to do so. Require the Cabinet to assign all individuals who are subject to SNAP work requirements to an employment and trading program. Section 19. Prohibit the Cabinet from using self-attestation of income, residency, age, household composition, caretaker or relative status, or coverage for the purpose of determining Medicaid eligibility without verifying that information prior to enrollment. Residents of an assisted living facility or long-term care facility will be exempt from this requirement because they generally have no reportable income. Require the Cabinet to use only the most recent income verification data available when determining eligibility for public assistance. Permits the Cabinet to deem individuals who traffic EBT cards ineligible for public assistance for a period of not more than 6 months for the first offense or permanently ineligible upon the second offense. Section 20 allows for an appeals process for individuals disqualified from receiving benefits due to this act. Section 21 provide the Public Assistance Oversight and Advisory Committee with a copy of any waiver application submitted to the federal government. Reapply for any waiver amendment, or state plan amendment associated with this act every 12 months if it is denied by the federal government. Section 22, require the Cabinet for Health and Family Services to take appropriate action, including enforcement of relevant federal regulations to assure that the responsible parent or parents of a needy dependent child provides support for that child. Permit the Cabinet to waive such requirements in the case of child abuse, domestic abuse, or if the Cabinet determines such actions would not be in the best interest of the child. Then permit the Cabinet to disqualify any individual from public assistance benefits during any month in which the individual is delinquent in any court-ordered child support. Section 23 requires the Cabinet to assess the additional cost to the state incurred by increasing eligibility to 200% of the federal poverty level, and an assessment of what the fiscal impact of discontinuing multiple co-payments for families with more than one child in CCAP. We are asking that we keep track of all that information so that we are going to establish a task force later on this bill that looks at bridging the gap for bridge insurance, but also for child care. And we want that information to see what would be the best way to help bridge that gap. Section 24 requires the Cabinet to apply for any waivers that might be necessary in implementing this act. Section 25 requires the Education and Workforce Development Cabinet to develop a website where private employers throughout the Commonwealth can post available job openings. Section 26 directs the Legislative Oversight and Investigations Committee to conduct an in-depth analysis of TANF, KTAP spending, and identify alternative sources of child welfare funding. Sections 27 through 29 simply directs the LRC to establish a benefits cliff task force to study and make recommendations regarding strategies to assist public assistance beneficiaries in bridging the benefits cliff as income increases. And then sections 30 and 31 directs LRC to establish a benefits cliff task force to study and make the recommendations. Pretty much the same thing. It's continuing on there. Section 32 provides the severability of this act. And that is what the bill does, Madam Chairman.
Okay, thank you. I really appreciate all of the work that you've done in meeting over the past several months, really, with all of the stakeholders who have strong opinions about this legislation. I know that significant changes have been made in the current committee sub, and so thank you for that. Thank you for your work on this. We do have Representative Bray.
Yeah.
Has an amendment that you'd like to offer, and I believe this is a friendly amendment.
Yeah, thank you, Madam Chairwoman. Representative Meade, I know you and we've talked a lot about switching to categorical eligibility and how that would affect free and reduced lunch. So what this amendment does is it deletes that section out of the bill. So I would move for adoption of House Committee Amendment.
Which section is he talking
That's been passed out.
What section?
So the document ID is 8269, and I believe it's in your packets.
Right. It is on page 19, lines 11 through 20 will be stricken, and then the rest of the amendment simply renumbers the following sections or subsections and that is in section 19. So that is the amendment. Is there any discussion from the committee? I think that this is something that the advocates have asked for. It's simply a clarification. We did have some questions about this, and I believe that this is a very friendly amendment. Is there any question, any concerns? Representative Rayburn.
So I have a question regarding Section 5. It would be on page 5, line 14.
Representative Rayburn, we're discussing the amendment right now.
Oh, okay.
So if
So
you
sorry.
can limit your comments to the amendment, we need to adopt this, and then we'll get to your question. Representative Elliott.
I'm not finding a copy of the amendment. Did you say it's in the packet?
Does everyone have a copy of the amendment?
Thank you.
I believe that was sent out as well.
Okay, yes, I believe so too.
Make a motion on the committee amendment.
Okay, we have a motion and a second. And as we've stated, if you take a look at the bill in section 19, this simply eliminates subsection 10, beginning with categorical eligibility through line 20. It strikes that section in its entirety. So we do have a motion and a second. Any further discussion? All right. All in favor, please say aye.
Aye.
Any opposed? Okay, thank you. All right, so the amendment is adopted. And now we can move on to questions about the bill as presented. So Representative Rayburn, did you have a question?
Yes, I did. On page 5, lines 14 and 15, it talks about the ability to recertify SNAP eligibility online. So it's my understanding that DCBS currently allows that process with the recert online, but it also, they have to follow up, a caseworker will follow up either by phoning the client or doing an in-person interview. Will this language change that process at all?
No, I would assume that it would still continue on the same exact way. And these just, of course, they're doing it online for everyone. We left that part in the bill just to say that it was going to continue. But this section is primarily for those who are elderly or disabled.
Okay, thank you.
Representative Wilner.
Thank you, Madam Chair. I have a number of questions, and some of them are high level and some of them are in the weeds. And should kind of just start with a high level question. The high level question is, can you help me understand the intent of this bill? What is the problem that we're trying to solve with this legislation?
We can start with, I have quite a few statistics here that we can talk about. One of the issues is the amount of ineligible folks who are estimated to be on Medicaid at this time, and making sure that whenever the maintenance of effort is lifted, that those rolls are accurate after that is done. That is probably the primary piece of this. Other pieces of it with putting benefits on one card is to eliminate any possibility of selling an EBT card. That was part of that was a suggestion by a bipartisan task force that we had in 2019. That was one of their suggestions. And then the biggest other piece of this is to create that task force so that we can develop a program that truly helps with bridge insurance for those who are on Medicaid but reach that limit and have to come off. We want to develop a bridge program that will assist them in making co-payments and those type things once they come off of Medicaid, but also we want to work on bridging that child care gap that is another hindrance to folks being able to participate in the workforce.
Thank you. Could I ask a follow-up?
Yes.
Thank you. As I read this, it looks to me like this bill is going to interact with a number of very large federal programs, and so TANF, SNAP, Medicaid services, and I know that those are all enormously complicated programs, and that they have an effect on child care assistance, that they have an effect on school nutrition services, summer nutrition services for students, really quite a long list of services that could be affected by this bill if we don't get it right. And so I'm curious to know what conversations in working on this bill that you've had with folks at the federal level to make sure that we're in compliance and that we're not going to cut off really critical benefits for folks who rely on them.
The programs that you're talking about and the primary concerns relating to your question would have been in the section that was removed from the bill by Representative Bray's amendment. It also, any additional areas where it may affect those programs, the cabinet will have to request their waivers as it is stated in the bill.
And will we hear from the cabinet, or have you spoken with the cabinet, and can you report on their position on this?
I have spoken with the cabinet, and I will let them report on it when they come up.
Great. Thank you very much.
Thank you, Representative Wilner. And I do know that Secretary Friedlander is online in person. I'm so sorry. There you are. I don't know if at this point you want to respond to some of these questions. I know that we have had numerous conversations with the cabinet about the effects of this legislation on any of the federal provisions. We're really trying to streamline and make sure that this is creating efficiencies and not creating barriers. And so we've had several conversations even about updating technology. And I think that that's something that might really help here. So I know that Representative Fleming has a question.
Thank you, Madam Chair. Speaker Pro Tem, Speaker, thank you very much for your diligence over quite a few months, as the Chairwoman mentioned. I'm just going to come from more of a verification standpoint, and since under Section 26, you have legislative oversight investigation system, I'm a member of that. I'm going back and looking at Section 3.3 and looking at verification purpose, and then there's other verification of how to verify on Section 4.1. Could you help me out in terms of trying to go through and how we can validate that the recipients are applying these cards unless they're actually outlined with embedded? It's historic. I'm sorry. Can y'all hear me now? Okay. Sorry about that. I'm just, like I said, I'm going to try to go back and verify that the items being purchased is being purchased correctly or for the purpose intended, because I think it goes back to what you're trying to accomplish in terms of if there's any fraud or anything like that's going on. Could you help me out so I can be mindful on the Legislative Oversight Committee when this comes through?
If I'm remembering correctly on everything, when we discussed this back in 2019 on the Public Assistance Task Force, there are algorithms within programs at the cabinet which will throw up red flags, which will indicate there may be a possibility of improper spending on those cards.
Okay, so all right, so there's some type of electronic strip or something embedded in the card in order to track all those things. Go back and verify that.
All those individual purchases like that are coded, and I think that as they develop the algorithm to basically track your spending, and it will throw up flags when there's anomalies that show up at particular locations, perhaps, or particular types of purchases.
Okay, so there's really just not any receipts I have to turn in or anything like that.
And obviously, there's no way to identify it all.
Yeah, thank you. Thank you, Madam Chair.
Representative Marzian.
Thank you, Madam Chair. You went through that so quick, it was hard to catch it. You said you had several statistics on this. Where did you get those?
Those came from the UK Gatton College of Business and Economics, and the Foundation for Government Accountability is where most of this came from, as well as the U.S. Federal Bureau of Statistics.
Okay. Is there a fiscal note on this bill?
There is not a fiscal note on this bill right now. It was requested a while back. It has not been received, but I pulled the fiscal note from the 2020 bill, which actually had more in it than this bill, and that was an estimated $20 million that the bill would initially cost, with $15 million of that coming from federal dollars and $5 million of that coming from state dollars. We will see much more of a return due to some of the items that will be implemented in this bill once we continue moving forward.
So I had some concerns when the speaker was talking about monitoring what you buy at the grocery store. It seems like you're almost saying the consumer or the person that has public assistance would have to surrender their privacy at the grocery store. Will that be happening?
That's not even close to accurate, Representative. And you
did say you're going to have.
You're very aware of the algorithms that exist within the cabinet right now to throw up flags. So I think any assertion that that there is surrendering of privacy is not genuine.
Oh, I'm glad to hear that. On this piece of legislation, it really seems like we're going after or we're trying to punish people for being poor when we really should be going after providers of health care or labs ambulance, which cost way more than a mom with 3 or 4 kids that might have gotten a month of food that she shouldn't have. I have several articles here. Kentucky businesswoman faces jail time for defrauding Indiana Medicaid of $1.8 million. They'd already had to forfeit their jewelry, mink coats, a grand piano, and her 6-bath, 3-garage, 3,400 square foot home with a swimming pool and a cabana. I doubt many of our SNAP recipients have that. St. Joseph in Whitley County had to pay the government $16.5 million by defrauding Kentucky Medicaid and Medicare with stents, cardiac casts that were totally unnecessary. That's a lot of money. The kickback fraud and drug scheme claims that Ale, a Louisville pharmacy company, up to $7 billion. Lab owner must pay $140,000 for Medicaid fraud.
Representative Marzian, do you have a question?
My question is, what are we doing to go after these huge amounts when we're trying to keep somebody from getting a month's supply of food that might feed 3 kids?
Well, you're exactly right. It's called fraud because it's illegal to begin with. So there are laws in place to combat that. Also in this bill, we are dealing with presumptive eligibility, which some of our hospitals are misusing it as well. And the Hospital Association was very kind to help us with that language to make sure that they held themselves accountable but did not hurt rural hospitals. So I think that there are several pieces in here that will be holding those providers accountable as well.
Okay, thank you. Representative Sheldon.
Just a quick question. Is there anything in this bill that would stop any person that it was in real need, somebody that qualified for the benefits, whether it be any type of benefit, SNAP or otherwise, in this bill that would cause them not to get it as long as they weren't fraudulently obtaining them?
The only way that you would lose benefits in this bill is that you are either doing something that is illegal or you are an able-bodied adult with no dependents that is not willing to participate in the work programs.
Okay. One more question. And then the presumptive eligibility you mentioned, it's still, the hospital still get the 30 days. There was a little change in that. I thought that was a good change. Can you remind me what that was? I know it was one, and then it changed just a little bit recently, or did I? Am I remembering?
Actually, that language changed pretty drastically. What it, the time limits and everything remain the same as they are now,
right.
But there are certain things now that hospitals have to do to make sure that they meet eligibility requirements, and they also have to make. I think the mic's on, but there we go. The folks making those determinations have the proper training.
Good deal. Thank you very much.
Okay, thank you. And Representative Raymond?
Thank you. I have several genuine questions. First up, I wanted to ask about the work requirement for Medicaid recipients. Under the previous governor's administration, a federal judge struck that down in 2019. A U.S. appeals court upheld that decision in 2020. How is that different in this bill?
This bill is just saying that the cabinet now has to request that waiver to make sure that we have federal permission to do that. Mm-hmm. We have talked to some folks at the federal level who feel that at some point, whether it's in this administration or maybe the next administration, that they are going to start moving towards allowing work requirements, and that's why we're saying that you will apply. If the waiver is denied, you will apply every 12 months until it is approved. But the Arkansas is probably the best example of this that was struck down. But there was some good data that was gathered from that while Arkansas was doing their work program. The data that they gathered showed that due to their work program, that state was on track to have about $300 million come back to it because of their work program.
Okay. Another question I have is about change reporting. I believe it's in this committee sub 2 that it's still 10 days that recipients of benefits have to update any changes in income. I'm concerned about people who may work overtime occasionally or tips each week, and by the time that they report that and it's processed and there's that burden for the recipient and for the worker that it's already a new dollar amount for those folks.
I'm sorry I didn't hear the first part of that question. Say that again.
I'm concerned about the change reporting, the new requirement that recipients have to report changes in income every 10 days. That by the time it's reported, it will have changed again, and it could discourage folks from seeking overtime or reporting tips.
It's not every 10 days. It's once there's a change, they have to report that within 10 days. It's quarterly reporting, but they have to change it report that within 10 days. And what that will actually, there is a potential for that to actually benefit someone if those to report it more frequently, because if they change, they will be eligible for more benefits or less benefits as they move through that process.
Let me ask you about the Public Assistance Oversight and Advisory Committee, the Medicaid committee that's going to transform into the Public Assistance Oversight and Advisory Committee. It says it'll promote workforce participation by public assistance beneficiaries. Great. Do we know what the workforce participation rate is among public assistance beneficiaries right now?
We can give you some numbers of that came from the Gatton College of Business and Economics from their studies that they have done, and how many they believe may possibly be on this. In an email that I received yesterday, they said that out of the 2.423 million working age adults in the state of Kentucky, they estimate 11.9% of those are qualified for Medicaid with income too high. So that would make, if they are able-bodied and not working, that estimate would be about 11.9% from their figures.
Okay. I don't know if I followed. I just think
but that 11.9 is of all able bodies in the state. So it isn't broken down to the able bodies individuals on Medicaid.
Right. And I think that's going to be something important for the oversight committee to look at. What's the workforce participation among public assistance beneficiaries versus people who are not receiving assistance at this moment? We do know that 65% of adults who receive Medicaid right now are working, which is actually higher than the state average for workforce participation, so we might have it backwards. Public assistance beneficiaries might be able to help some other folks get into the workforce. I'm concerned about language. I know it's may, not shall language, that the cabinet could institute lifetime bans on public assistance for Kentuckians who sell their EBT cards 2 times. That may language, it doesn't make me feel much better because there's that discretionary piece of it. What protections can we put in place to make sure that that is applied equitably? I foresee a future where there are racial discrepancies in enforcement of permanent bans.
As you said, it is a may, and I think the cabinet will have far more information. That is why it is may, because they will have far more information than we have right now to make those determinations. And we're not comfortable with putting anything in the bill that's going to require the cabinet on that situation, or in that situation. Each situation will vary, and I'm sure circumstances will vary for each person, and the cabinet will make that determination.
Okay, one more question, please. This says that recipients can only use cash. They withdraw with their EBT card on things that are necessary for the welfare of the family, right? Things that are necessary for the welfare of your family are different than things that are necessary for the welfare of my family. Again, this goes to the cabinet, but it's so subjective. How do we track that cash spending? Who's determining what's necessary?
Again, that would be the cabinet, and we're reinforcing is the federal guidelines on that, and they will make that determination again because each instance is going to vary.
Thank you.
Okay, thank you. Representative Dotson.
Yes, real quickly. Those who legitimately qualify for these programs are going to get them. But I think this Commonwealth is long overdue with welfare reform and purging those out of the system that really doesn't need to be there. Again, we are 48th in the nation in workforce participation, and we're going to find out over the long haul that some people are hiding out in the system. And so I think this is a great first step for Kentucky. It's not going to answer all the problems. There may be things we may have to come back and face in the future, but I do believe this is a good first step, and I do appreciate you gentlemen working on it.
Okay, thank you so much. I would just like to reiterate that some of the unobligated TANF funds that are being identified in this language will go to the Job Placement Assistance Program, and so we are not imposing something that we're not willing to actually put supports in place for individuals. The other piece of this that I think is really important is the public assistance oversight. This will allow us to have ongoing conversations about what's working, what isn't, what do we need to change, and really make recommendations. So this is not the last conversation we're having about this issue. I think that this is well thought out. So I don't, Representative Elliott, do you have a question?
I do. Thank you, Madam Chairman. Thank you, Mr. Speaker and Mr. Speaker Pro Tem, for your work on really, I think, a difficult issue. Section 6 deals with the community engagement portion, which we've heard a lot of back and forth on. There are some exemptions and exceptions to that, and would you all go through those, because I think those are fairly important to note that this isn't a blanket approach to the community engagement portion, and I think those are important to point out for the committee.
You're exactly right. There are several exemptions to those work requirements. For those who are age 16 to 59, they are exempt if they work at least 30 hours per week, meet work requirements for another program such as TANF, are unable to work due to physical or mental limitations, are a caregiver of a child under the age of 6 or an incapacitated person, are participating in alcohol or drug treatment programs, or enrolled in school or a training program at least half-time.
Okay, thank you. Representative Raymond.
On that note, Madam Chair, I would like to make a motion to amend this committee sub with a committee amendment that I have. Staff has copies. It's doc ID number 8246. What this would do, as we're talking about workforce education and training, is require the development and implementation of an online employment and training program for people who are required to complete the work requirements to maintain their benefits. There are only 1,000 in-person SNAP education and training slots right now in Kentucky for the 500,000 Kentuckians who receive SNAP, and the number of slots varies by county, and of course there are transportation concerns. This amendment actually reminds me of the chairwoman's House Bill 565, which we passed last week on the floor, which would offer some criminal justice training online. I believe that this amendment will give folks the best chance to re-enter the workforce. I'm seeking a second.
Oh, second.
Thank you. Thanks. Thank you.
Okay.
Madam Chairman, if I may very briefly speak
Yes,
on
sir.
that. Representative Raymond came to me a few days ago, which I certainly appreciate. She came to me today as well to discuss this amendment, and after I have looked into it and read her amendment, I find this to be a friendly amendment.
Okay, thank you very much. I had the same reaction. I like moving to online training, and I think this is a good amendment. So I will entertain a motion, and on the amendment, we have a motion. We have a motion and a second. Do we have any discussion? Yes, Representative Bray.
So when it says online employment and training program, and I guess this is for Representative Raymond, what kind of employment and training are we talking about? Like learning how to get your CDL, or just general broad training?
So I believe that we could put online a program that would mirror or complement the SNAP education and training program that currently exists in 5 locations with 1,000 slots across the state.
Thank you.
Okay, thank you. Any further questions? Representative Birch.
Madam Chair, I just got a couple questions. One is about this 80 hours work for a month.
Representative Birch.
Where did they find this work?
Representative Birch, is this discussion on the amendment?
Oh, I'm sorry.
Okay, all right. We're going to go ahead, and if there are no further questions or comments on the amendment, Representative Fleming.
Thank you. I just want to ask the representative, in terms of the online, what's the accessibility for these recipients to access online capabilities. And then, yeah.
I hope that through our other work here in the legislature, everyone's going to have access to get online. This is to complement and to break down barriers, right? We know that some people have barriers to getting online, and we know that some people have barriers to transportation. So we're just trying to offer another avenue to see what will work for folks.
Okay, well, I appreciate the answer, but we need to be very mindful and conscious of when we say online employment, because I hear constantly, particularly in certain parts of Louisville, that there's no access to broadband and no access to online. So I think we need to be very cautious of what we're trying to say here if we're going to alienate a certain group of people not having access.
This will be an option.
Okay, thank you. And thank you for that, Representative Fleming. I do think that this is an optional provision, and certainly, we are implementing broadband throughout our state. So I think that this will be more of an option for folks. Okay, Representative Bowling.
Is this optional to the people that are seeking the training, or is this optional to the people offering it?
So to the extent permitted by federal law, we are asking for the development of an online program that will be optional for public assistance recipients as they look at that menu of options to fulfill their work requirement.
Okay, so they can still go to a physical place
Absolutely.
for this. Okay, thank you.
Yes, thank you. Okay, all right. Seeing no further questions, we will take a voice vote on this amendment. Document 8246. All in favor, please say aye.
Aye.
Any opposed? Okay. So the amendment passes and will be either rolled into, we can discuss if you want to roll this into the committee sub at the end. Okay. All right. So we do have a few folks who have signed up to speak. And at this point, I would like to, well, actually, before we go there, I think Representative Birch, did you want to finish your thought?
Just finish maybe two questions.
And please pull your microphone a little bit closer.
The 80 hours. How do you? What's your thoughts about that 80 hours in some areas of this state? Where are they going to get 80 hours in, or how are they going to get to the place to put in the 80 hours, or who's going to watch the kids? How do they do that?
Thanks, Representative Birch. The 80 hours is per month, which is already part of the SNAP work requirements
Right.
that are in place right now. Secretary Friedlander can correct me if I'm wrong, but right now the federal government has a stop on those SNAP work requirements. Once they lift that, we will go back to the way that we were prior to that stop, and they will continue on with those 80 hours. If you have a child at home, you're exempted from that. It is also not just about work, it is also about the training programs and community engagement as well. So the 80 hours would be a combination of all those or one of those.
And the cabinet would be totaling this up or tracking this, right?
Yeah, they would continue to do it the same way they
They're
have
doing it
prior
right
to.
now.
Yes.
Do
you have
just
another question?
I have one other question. Is this going to affect the amount of money we get from the feds on food stamps?
No, there should be it should not affect any of that. Anything that we have to do in here, the cabinet will apply for the waiver. And so the federal government would have to grant those.
Okay, thank you.
Okay. Now, I'm going to allow a few minutes to the folks who have signed up to speak. I would just please implore folks to speak to the committee sub. I know that you are just now seeing the language, but many, many changes have been made. So if you have something that you'd like to speak about pertaining to the committee sub, I would like that to be in order, and please keep your comments to 2 to 3 minutes. And if you have duplicate comments, or if we can have one spokesperson per organization, that would be helpful as well. Okay, so we have Mike Wynn with Grace Health, and Celine or Carissa with the Louisville Urban League, and then Reverend Gilbert with the Council of Churches. Okay, so if you can just make your way to the table and introduce yourself for the record, and keep your comments brief, please. You just have to push the button and make sure the light's on.
Got it. Okay. Thank you for the opportunity to be here. My name is Michael Wynn. I have been serving Kentucky as a connector for almost 7 years. And if you're not familiar with the role of a connector, we basically assist, educate, and oversee Kentuckians who are applying for health care, or especially Medicaid, expanded Medicaid, or K-CHIP. And so that role has given me the opportunity to serve southeastern Kentucky. I've met people from every walk of life, in every type of situation. It's not uncommon for me to be sitting across the desk from somebody who is having their very worst day. And man I spoke with about 3 months ago, he'd lost his job because of COVID. He had spent a month in the hospital being treated for COVID. While he was in the hospital, his wife died from COVID, and he was coming out of the hospital to take care of his children, try to find work, and find health care. We were able to help him, and his children qualified for K-CHIP. But because of the blows of life, because of the challenges of life, John was in a very, very fragile state. And so we're not only helping access health care, we're accessing hope and courage and trying to meet people where they're at. I'm here to testify today on behalf, or on this bill, House Bill 7. It is what I've heard. It's got some very exciting opportunities, but I am against anything that would require stricter reporting, work requirements, more verification, because in my experience, in my opinion, outside of the state of emergency, the verification process, requirements processes that we have currently are sufficient to qualify somebody or disqualify somebody for those benefits. So I'm here to ask that we don't punish Kentucky's hardworking people who are in transition or trouble. Don't punish them for the few bad actors that abuse the system.
Thank you, sir. And before you get started, I just want to let everyone know who hasn't maybe heard this. We have worked hard to pass the Community Health Workers Bill this year, and much like connectors, we're very concerned about connecting folks and helping them navigate what is often a complicated system. So I appreciate your comments. The intent is certainly not to make this more difficult, but to hopefully streamline the process. Okay.
Hi, everyone. My name is Celine Mutia Maria, and I am a community policy strategist at the Louisville Urban League. Prior to this, I was a community health worker at Shawnee Christian Healthcare Center, and prior to that, I was a graduate student who relied on social safety net programs like SNAP to get me through long days and long nights of studying. When I finished school, I was in search of a job, and I relied on Medicaid benefits to update my eyeglass prescription and access to other vital health services. Navigating the process of applying for these benefits was very difficult and time-consuming for me, and I am someone with a college education, stable housing, reliable internet, and reliable transportation. Despite these many privileges, it still took me several weeks, going on months, and many appointments with caseworkers to get through all the red tape, documentation, and verification processes required to apply for SNAP and Medicaid. This experience was very dehumanizing because I essentially had to prove that I was suffering enough and worthy enough to deserve these critical basic needs. When I became a community health worker, I witnessed how much more difficult it was for people who didn't have the same privileges as me to access these benefits. Parents, children, seniors, those with disabilities, Working adults and many people experiencing poverty go without basic needs because of the cumbersome process of applying for benefits. Those in rural areas who struggle with reliable transportation and internet literally have to jump through hoops and hurdles and make miracles happen simply to access benefits that are critical for healthy communities. This bill would make a very complex process even harder and nearly impossible for some, and I struggle to understand why this bill is being brought up. I urge the members of this committee to think about the very real consequences of this bill. This bill further criminalizes poverty, and it will make life after a pandemic even harder to recover from. And I'd like to close by saying that I was a connector when our last governor attempted to implement the 1115 Medicaid waiver requiring work requirements for people, and the undue burden that I faced as a connector to relearn the entire system and relearn all of the new requirements that I would have to hold my clients accountable to made me want to quit my job. And the only reason I didn't quit is because that waiver didn't go through. So I just imagine how much of a burden this will be for the caseworkers who are already really struggling to keep up with the high need. Thank you.
Thank you so much thank you for your comments and for being here today. Thank you for your work as a community health worker as well. We have a few other individuals. Reverend Gilbert is making his way to the table.
Madam Chair, was there someone before me? I didn't want to jump my turn.
No, you're perfectly fine. You go right ahead. And it looks like we have someone else who would like to speak, and I would just ask that you don't duplicate comments if something's already been discussed. So, Reverend, please proceed. Introduce yourself for the record.
My name is Kent Gilbert. I'm the Chair and Advocacy Director, Chair of the Commission for the Kentucky Council of Churches, and I'm here at the behest of the bishops, conference ministers, and regional leadership of the 11 denominations and 16 judicatories that you can find out all about, and you probably already know. Many of your own traditions have been a part of the 75-year tradition of the church and the churches coming together to gather our collective wisdom and to discern together what is right, what is good, and what we might do in our common work to make whole those persons who are poor, ill, imprisoned, and hungry. Now, we've got about 2,000 years of tradition of doing that as congregations. We have a 275-year tradition of doing that in Kentucky, which predates even the legislature's ability to care for those. And we have grave concerns about this legislation and about several other bills that you are considering that do, in fact, create a negative climate. You heard previous speakers talk very antiseptically about how we could save $300 million if we could just starve 500,000 children. This is not an acceptable way. The enemy here is not SNAP benefits. It's not workforce participation. The enemy here is that 1.4 million of our citizens, our sisters and brothers, are living below the poverty line. It is not something that any individual of them is somehow defrauding us all, but conditions, pandemics, all of these things have called forth from us not the lifeboat that is needed to get to shore, but it seems like it's called forth a bunch of carpenters with drills looking to dismantle the boat while we're still at sea. None of us here in this room likely are in that lifeboat, so I understand that it may be hard for those of us who are comparatively wealthy and comparatively middle class to understand, but all of you are good people. All of you have children and family and friends and neighbors. All of you have been in a bad spot. And so I ask you that instead of taking pot shots from the shore at the things that are keeping people afloat, that you might look deep in your faith and you might see in this bill and in other bills ways that we could, in fact, lift people out of poverty. We know for a fact that folks who are on SNAP benefits, for example, are primarily working folk. And they don't always stay on SNAP if they can get to jobs. I applaud those measures in this substitution that will provide greater access to greater opportunities. I deplore the aspects of this bill that are weaving a web of red tape and coating it with the sticky ichor of some sanctimonious outside group like the FGA that wants to waltz in here with millionaire salaries and tell you that somehow they're going to do it right. Even though it failed in Arkansas and 9 other states, we're going to do it right for Kentucky. Just trust us, the outsiders. I would much rather, my friends, that we remember that they who oppress the poor show contempt for their maker, is what Proverbs tells us. And whoever is kind to the needy and honors them honors God. I hope you will pray and I hope you will ponder carefully as you head toward lunch, and I know you're all looking at it just like me. That next meal for me is going to be easy, and its only decision I have to make is what I want. You too, probably. But I pray that at that lunch that you are about to have and at the meal tonight, that you will take your children and your grandchildren into your mind, and that you will think what it'd be like to not tell them, to not be able to feed them that night. If we pass this bill, you will create impediments to good care. It will take deserving Kentuckians food from their mouth, medicine from their cabinet, and opportunities from the table. Thank you.
Thank you. All right. Ma'am, please introduce yourself for the record.
Thank you, Madam Chairwoman. My name is Carissa Arnold, and I am a Kentucky farmer in Woodford County. As you directed, I will not repeat anything that has been stated before, and I think everyone has done a good job of outlining the challenges that our poor face, and this bill would greatly encumber those even further. So I would just add that 1 in 6 Kentucky children will go to bed hungry tonight. 1 in 6. In the last 6 years of farming, I have donated, personally, my farm and family have donated over 5,500 pounds of food to the needy. If our community can take care of the hungry, then our lawmakers should take care of the hungry as well. Food and health care is a basic human right. Thank you.
Sorry, I'll turn my microphone on. Thank you very much. I appreciate your work as a farmer and your concern for the hungry. Certainly, we all share those concerns, and our goal here is to ensure that this safety net remains in place for those who need it. I know that Secretary Friedlander, did you want to say a few words? And I would like to wrap this up shortly.
Thank you, Representative Moser. I'm Eric Friedlander, Secretary of the Cabinet for Health and Family Services. I will be brief. First, I would like to thank Speaker Osborne and Speaker Pro Tem Mead for meeting with me on this bill. And
is your microphone
oh,
on?
Yes, it looks like it's on. So
sorry. All right.
I'm not used to this in-person thing. I'm sorry. I'd like to thank Speaker Osborne and Speaker Pro Tem Mead for meeting with me on this legislation and going over the places where we agree. Also, from what I've heard today, it sounds like there have been some improvements made in this bill. However, there were places where we disagreed. And these comments, I have to say, are related to the original, not the sub, but I can't speak to the sub at this point, and I apologize for that. And many of you have this letter. Too many Kentucky citizens have limited access to food, health care, behavioral health care, and other critical assistance. The original version of House Bill 7 would make it harder for Kentuckians in need to get assistance for food and health care, hurting families, seniors, children, and those with disabilities, and especially those in need of behavioral and substance use treatment. It will also hurt grocers and health care providers who will increase the regions in the Commonwealth that lack access to health care, food, child care, and other assistance Kentuckians depend on. Specifically, many parts of the bill will cut benefits to our lowest income Kentucky families. This will further burden parents, caregivers' abilities to support their children and household. As you know, people who lose Medicaid coverage would more likely rely on expensive emergency department visits or delay seeking care or not seek care at all. House Bill 7 also adds recertification requirements that would hamper Kentuckians seeking treatment for behavioral health and substance use needs, two areas that are already in crisis in Kentucky. I believe the rate of the uninsured Kentuckians could increase by 10%. House Bill 7 also places several deadlines on CHFS, again, it's certainly the original, without providing the funds for additional resources for staff, With limited staff that is already stretched to the limit for current SNAP and Medicaid eligibility decisions, CHFS would not be able to meet the unfunded mandates in House Bill 7. The workload increase would cause a major backlog of cases in many areas, including child care, SNAP, and Medicaid, and cause disruptions for individuals attempting to access services. Although Medicaid recertifications would impact the Cabinet in two ways. Heard some changes for the first. The end of the federal COVID public health emergency declaration would have required the Cabinet to, within 60 days, reprocess about 180,000 applications. That would have been impossible. In addition, new recertification requirements could add at least another 100,000 calls per month. This requirement for applying and recertifying for SNAP would also significantly increase administrative workload. Simply put, this would overwhelm our workers and systems. There would also be a significant cost to Medicaid providers, and all healthcare providers would lose revenue because of the increased unavailability of Medicaid reimbursements for individuals who do not have healthcare coverage. I appreciate the opportunity to express the Cabinet's concerns. And again, appreciate the willingness to work with us and appreciate the opportunity to speak here.
Absolutely. Thank you, Secretary. I appreciate your comments very much. I know that we've had some comments or conversations rather prior to this meeting about really your workforce limitations, and I am looking for ways to help the Cabinet make some of those improvements that might help streamline what you're facing right now. So, Representative Wilner, do you have a question?
I do. Thank you, Madam Chair, and thank you, Secretary Friedlander, for commenting on this. And we're all aware of how overextended the Cabinet is and the employees. And I'm hearing in the presentation of this bill and in some of the comments about a lot of additional requirements and, frankly, burdens on the Cabinet. Do you have an estimate of what that would cost Kentucky taxpayers for the Cabinet to pick up this extra work?
We do, I'm sorry, a fiscal note was filed, I think, late last night, so it was late. And we think, as we look at the workers, the addition just there, we think we'd need to probably double our current workforce. You're talking 500 new employees. That's a significant, that's tens of millions of dollars in order to be able to answer the phones. That's one of the reasons I'm here. I want to make sure you all know, if I don't think it's possible, and that there could be a significant backlog on phone lines. We already have 20-minute waits, and if this doubled that number, I just think we'd have the potential for a real disastrous situation.
Thank you.
Okay, thank you. Actually, Representative Bray first, and then Representative Rayburn.
Yeah, I've just got a quick comment. Secretary Friedlander, I'm glad to see you all are allowed to testify in person again. I've only been here 2 years, but this is the first time I've seen somebody from the administration over here. It is much more effective in person. Thank you.
Representative Rayburn.
So, thank you for your comments, Secretary. My question is regarding the Medicaid and the recert process. So currently, under the new system that was implemented, I want to say 2012, 2013, around that time, it has the ability to check eligibility through the state and federal hub to determine eligibility. With that current process, wouldn't that help expedite things if in the event this does, guidelines change within the federal government? That's my first question for you.
Yes. It was called Benefine back then, but it's called Connect Benefits now. Does have the ability particularly to check against federal information and even some state information for eligibility pieces. The way that we were reading the original was that there would be additional really paperwork requirements on some Medicaid pieces that really we haven't been doing probably since the 90s. So that's where our concern comes in.
Okay. One follow-up, please. Do you think it would be more effective maybe to change the current process, which is statewide processing on these cases, back to the county level?
Oh, no. We had when I came in as secretary in the beginning for the cabinet, that was the process that we used. The counties were actually responsible for both SNAP and Medicaid. At that point in time, we were really struggling to answer 4,000 calls a day. We're up to being able to handle around 15,000 calls a day. We get about 20. But that shift, I think, really helped us pretty quickly double the amount of calls that we were able to take to move to a statewide system. I do know that DCBS workers prefer to work with folks in their local counties. It's just the difference in the volume we were able to handle was so significant that's why we're doing it the way we're currently doing it.
One more follow-up, please. I worked for DCBS for 2 years and processed a lot of the cases at the statewide level. And there were certainly challenges when it came to too many hands in one caseload that would cause a recipient to receive either too many benefits or too little benefits. So I'd like to see the cabinet maybe address some of that policy.
Yes. Thank you.
Thank you, Representative Rayburn, for those comments. And I too, we've had these conversations about updating the technology. In 2022, I think that, if you can use TurboTax to populate your tax information, that we should be able to find some technology that helps with some of the manpower issues that you're having. Also creating partnerships. Across the state, we have career centers, we have community health workers now, we have connectors. It seems to me that maybe Representative Rayburn's right, and we address the policies internally, and it's complicated. I don't want to diminish that, but we are looking to assist with this and just really modernize our public assistance. That's really what this is getting at. So we do have a motion and a second on the bill. I have a couple of people. I don't know if there's something that folks who have signed up to speak have to offer something different that hasn't been stated yet. I know that Ms. Curry, you're online. If you can take just 1 or 2 minutes, and then we'll go ahead and vote.
My apologies. I was trying to unmute.
Okay. Please
my name is
introduce
Keisha
yourself.
Curry, and
If you could introduce yourself for the record, please.
my name is Keisha Curry.
Thank you.
I'm a proud resident of Paducah, Kentucky. I'm currently employed as a regional behavioral health consultant for Signature Healthcare. I'm also the proud parent of 2 adult sons, but my journey hasn't come without its stumbles and falls. There's been times when I found myself unemployed with little to no income. There have been countless times I didn't know where my next meal was coming from. What you see before you is a product of public assistance. My story is a story of success and evidence that the system does work. And I wouldn't trade my journey because it's allowed me to be truly appreciative of the struggle and has given me the desire to pave the way forward for others. Years ago, I made a decision for my sake and for my small family to play the hand I was dealt to the best of my ability. Perhaps there are some Kentuckians who take advantage of public resources. However, there are thousands of hardworking Kentuckians like me who fight to build a better life for their families. And I'm reminded of a parable in Matthew 13 of the wheat and the tares. In this particular parable, the enemy came to sow tares, which were weeds that resemble wheat. The wheat and the tare had begun to grow together, meaning they became intertwined at the roots. In the servants' eagerness to pull up the tares, they were warned that by doing so, they would surely uproot the wheat, thinning out the crop in the process. House Bill 7 would surely uproot the wheat by taking away the safety net for thousands of Kentucky families and low-wage workers who strive for better lives for their families at a time when food prices have risen. Without public assistance, I would have not had the opportunities to graduate with a bachelor's in social work. If it had not been for public assistance, my then 18-year-old son would not have received an early diagnosis of multiple sclerosis prior to his freshman year of college. There was a time I was penalized and considered ineligible for assistance due to child support that my ex-husband refused to pay. The amount was considered income, even though it was evident he wasn't paying it, putting me $2 above the income limit. I was forced to turn to family and friends, local food pantries, and churches for help, which made my situation more stressful, not to mention embarrassing. I've been told by a caseworker to sell my only vehicle. I had to put food on the table for my family, as opposed to receiving public assistance. Living in a rural area, this was not an option. I needed transportation to seek employment and resources. In the conclusion of the parable, we have to trust our legislatures to be as wise as the farm owner was. He instructed his servants to wait until the wheat was mature, and then they could take out the tares and harvest the wheat. Our legislature should be able to find a way to remove those who offend without destroying thousands of people in the process. HB 07 creates barriers for Kentucky families in need. Thank you.
Thank you, Ms. Curry. Please refrain from any unnecessary. We are not unsympathetic to your situation, and absolutely we are attempting to ensure that the safety net remain in place for folks like you. You are a success story, and I think that that is what we all want. And so you're talking to folks here in this committee who have worked on things like bridge insurance and the benefit cliff, which creates a perverse incentive for people staying on the system. These are all issues that we're working on. So I would just implore you to keep talking to us. We do hear you. So 2 more speakers have joined us at the table. If you can keep your remarks to 1 or 2 minutes, I really would appreciate it. We are limited on time. Thank you.
I appreciate your time very, very much. My name is Christina Libby. I'm a resident here in Frankfort, and I am a certified community health worker and a connector. And the thing that I want to do is try and dispel what seems to be a persistent and dangerous myth, and that's the great discrepancy between the intent and the reality of those who qualify for benefits are going to get them. That is a myth right now. As the Homeless and Housing Coalition of Kentucky Health Outreach Navigator, there's very little doubt that almost everyone that I interact with is not only eligible for assistance with food and health care, but they're exactly why we have these supports in place. And a huge part of my job is trying to help people get help. I'm a go-to person, and I find it hard. It's infuriating and unnecessarily complicated. I help clients with online applications with my computer because they don't have access to one. They may not have a phone or email, an address, online banking. Getting help is already hard, very hard. It's a demoralizing and discouraging process. Many people that I work with would be doing better if they had this help. I'm trying to skip over the things that other people have already said. So one of the things that has not been said are the specific examples of people who this is affecting, my clients, the people that I work with every day. I have had people turn down for benefits who should be getting them because they weren't able to show proof that they didn't have unearned income by way of a savings account that earned approximately 23 cents over the course of a year. They didn't have a printer. They don't have online banking. They couldn't provide this proof. They didn't know how to do it, so they didn't get it. Someone had to provide a written statement from her elderly neighbor stating that the elderly neighbor had bought groceries for my client and her children, but she promised that she wouldn't do it anymore because that would be counted as income, but the elderly neighbor didn't give her the letter in time, so she didn't get food stamps for her children. A client didn't realize that the shelter was sending their mail back because they had exceeded their time limit, so they missed the request for information. clients with substance use disorder miss notifications all the time. And I know that we have said in writing that we're making exceptions for these people, but to make an exception, you have to have proof and verifications, and that's very hard when you're currently in recovery or in a treatment center. And I could fill pages upon pages of why all of these restrictions basically make it impossible for someone with severe mental illness to get the help that they need to do and get better. And again, you have to prove that you have a disability. That is a hard thing to do. It is very hard to prove you have a disability. Everything is hard enough. Staying healthy, being a single mom, getting through this pandemic. People are asking for help. And if we want people to do better, if we want people to work, if we want to stop, we have to stop making it harder to get food and health care. And I just don't understand why we're willing to sacrifice a large number of people who currently are eligible for benefits and can't get through the system for a very, very small number of people who might be getting benefits that aren't eligible. And it's not even because they're defrauding.
I understand, and we just need to move on. We have heard all of you. I don't know if your comments are going to be different, but certainly, we need to modernize our system at the same time as we're dealing with SMI waivers and talking about how we support populations that are underserved.
Can we modernize first?
Well, I mean, I think it can happen concurrently, actually. So, but thank you, sir. Will you please introduce yourself for the record?
I will be brief.
Thank you.
My name is Chuck Eddy. I'm of Lexington. I'm just an ordinary person. I'm not part of any group or anything. Good morning, Chairman Moser and committee members. I'm firmly opposed to HB 7. As a Christian, as a follower of Christ, I believe that HB 7 represents a serious reduction in the needed services to more than 500,000 of the poorest Kentuckians. And it's going to place new barriers to the application and recertification process. As the lady mentioned, there's enough problems already. As the Secretary mentioned, there will be a massive increase in what is needed here. This is a draconian disregard for the needs of poor children and their families, and it's going to needlessly complicate and make more expensive the state's oversight. Ladies and gentlemen, many of our ancestors were poor people who came from Ireland. Please vote no in honor of their memory. Thank you.
Thank you so much for being here. And once again, I don't think that you've seen the committee sub. Some great changes have been made. So
Can I make a quick comment?
Here quickly, we're going to go ahead.
This will be quickly, and I know she needs to speak. The situation with committee subs, when we come here to testify about an original bill, and then the committee sub is put in, and then we're asked to speak just to the committee sub, it's untenable. I don't like that process. I'm sorry.
I understand. Thank you. 1 minute.
You got it. I'll give you 30 seconds. Brenda Rosen, Executive Director with the Nationals.
Thank you. Brenda Rosen, Executive Director, National Association of Social Workers, Kentucky chapter. 4 decades of social work, nightmares, and inspiration at the same time. I just want everyone to see what thousands and thousands of children go home with on a Friday. Their last hot meal is noon. They don't come back to a hot meal till Monday morning in school. This is what many children across Kentucky survive on over the weekend. Many of them give that to their siblings. Some of the food is taken by other family members, and I really want to stress whatever we were doing, we have to do it. We have to do it for the kids. So if anybody wants this, this is what they'll be living on for 70 hours. Thank you.
I do appreciate your comments and all of the concerns raised here today. Secretary, please take the roll.
Representative Bentley.
Explain my answer. I'm voting yes. I'm leaving the reservation. I may vote no on the floor because I want to understand all these sub-amendments. And it's a very complicated bill with many pages, and I don't think you can understand it in 5 minutes. Thank you.
Thank you.
Representative Bowling.
Yes.
Representative Bray.
Yes.
Representative Birch.
I'd like to explain my vote.
Yes, sir.
One, I don't know if the sponsor or these sponsors ever went without a meal. I doubt if anybody on the panel here has, because they were poor. I have. I've been there, and I know what it's like to wonder when your next meal's coming from. This is an evil bill. It's not a bill to streamline our system. It's an evil bill. It's a bill that's going to hurt people. In fact, they'll hurt every constituent of every member in this panel, and including the speaker and the speaker pro tem. They're going to hurt their own constituents. And by that, I vote no.
Representative Dotson.
Yes.
Representative Elliott. Aye. Representative Fleming. Aye. Representative Frazier Gordon. Yes. Representative Marzian.
Explain my vote. I was really impressed with the preacher from the Council of Churches. And he's right. Many of y'all wore bracelets around years ago that said WWJD. What would Jesus do? Would he make it harder to get food for poor people? I don't think so. I vote no.
Representative Gibbons-Prunty.
Explain my vote.
Yes.
I'm voting yes today because I worked as a Christian and went into homes, worked home health physical therapy for 10 years. I saw that we were handing out fish, not teaching people how to fish, and I believe this bill will help empower people. I think it'll help. That's what we need to be doing. It'll be for my single moms who want to work. It'll help bridge those gaps, and I vote yes and thank the sponsors for their hard work.
Representative Rayburn. Yes. Representative Raymond.
People are going to starve to death while we're teaching them to fish. I vote no.
Representative Riley. Representative Sharp. Representative Sheldon. Yes. Representative Tate.
Yes.
Representative Weber.
Yes.
Representative Westrom. Representative Wilner.
Briefly explain.
Quickly.
We're putting barriers in place for people who are just struggling to get by, struggling to feed their families, making choices between eating and medical treatment every day. I vote no.
Chairwoman Mosier.
Yes.
Thank you.
Okay, House Bill 7 passes as amended by Committee Sub 2 and amendments document IDs 8246 and 8269. And we need to roll the amendments into a committee sub. We have a motion and a second. All in favor?
Aye.
Any opposed? Okay. Thank you very much. All right. Next, we are going to move quickly on to, and hopefully we can get this done in just a few minutes, House Bill 569. Is Representative Callaway with us? Thank you. And I know that you have some guests online, maybe? Yes, ma'am. If you can introduce yourself and proceed.
All right. Thank you, committee. Appreciate the opportunity to be able to present this bill.
And we do have a committee sub.
My name is Josh Callaway. And
motion on the sub.
We have a motion and a second on the sub. All in favor of adopting the sub?
Aye.
Any opposed? Okay, thank you. Please proceed on the sub.
All right. My name is Josh Callaway, State Representative from District 10. I was here before you not too long ago with a different House bill, and bring before you House Bill 569 after a lot of research, a lot of work with a lot of people on this committee, as well as with the gentleman that I have online with me today. His name is Mr. Mac Haddow, and he'll be joining us here to give any information. But I just want to cover very quickly what the bill does in front of you in regard to the product of Kratom. First of all, Section 1 just lays out definitions inside of the bill, and you can look those over. The primary thing that we were trying to do was define what a Kratom retailer was. The second part lays out licensing fees. The third part deals with the substance of the bill, that deals with age limits, adulteration, contamination, extraction limits, as well as labeling. Section 4 deals with the penalties of the bill. And then Section 5 is kind of a default that says should the FDA or DEA come out and make a decision on this, we would automatically default to whatever their regulation was as a state. And so that's basically what this does.
Okay, we have a motion and a second. And I would just like to quickly comment and commend the bill sponsor on this legislation. we all had some misgivings about, where do we go with this? We don't know a lot about Kratom, but I think in the meantime, because it is on our store shelves, we are seeing it everywhere. We don't know enough about it to necessarily ban it. We're waiting for the federal government and the FDA to take some stance on this. But my problem with this, and I think you share this, is that children can buy this.
Absolutely.
And kids can buy this. And we need to just ensure the safety of kids. And so I appreciate your work.
And
on
that is what this bill does. It puts safety guardrails in place until we move further as a society or someone takes a position on it. At least we're protecting our children and protecting the consumer by making sure that we have pure product out there, unadulterated.
Right. Thank you so much. Representative Bentley?
I spoke with the people from Kratom, the association.
Microphone, please.
I'm sorry, I was looking at you. I spoke with them, and I asked them if they were overdosing on Kratom, and they went to Mayo Clinic, would they use Narcan on them? And they told me no. They're wrong. They use the same receptors as an opioid. So if they don't know their product any better than that, man, we need to do something.
Yeah.
Thank you.
And to your point, I think there's also some consideration where testing has been done that people that Narcan responded on, that the product was also adulterated. So there was with fentanyl or something of that sort that caused it to work. So I think there's some opinions about that.
It works on the mu receptor.
Yes,
period.
Sir. Thank you.
Thank you so much. Thank you. Okay. Well, we do have a motion and a second. Do we have any questions? Okay. Madam Secretary, please take the roll.
Representative Bentley?
Yes.
Representative Bowling?
Yes.
Representative Bray?
Yes.
Representative Birch? Representative Dotson?
Yes.
Representative Elliott? Representative Fleming? Representative Frazier Gordon? Representative Marzian? Representative Gibbons Prunty?
Yes.
Representative Rayburn? Yes. Representative Raymond? Yes. Representative Riley? Yes. Representative Sharp? Representative Sheldon? Yes. Representative Tate?
Yes.
Representative Weber?
Yes.
Representative Westrom? Representative Wilner?
Yes.
Chairwoman Mosier? Yes, ma'am. Okay. House Bill 569, as amended by the Committee Sub 2, passes with favorable expression, and the same should pass on the House floor. Thank you for bringing this. I apologize to Mr. Haddo online. I know that you are here to answer questions. Hopefully, we discuss this. We've had conversations prior to this, so I don't want you to feel completely shortchanged. Is there anything that you'd like to add just quickly that we didn't really cover?
Chair Moser, thank you. Just one thing. There was a letter released by Secretary Becerra, Department of Health and Human Services yesterday, that I will forward to you and to the committee, that identifies the fact that HHS now recognizes that current science shows this is not schedulable, that in fact it has health benefits, and FDA is now going to embark on looking at new drug applications. But in the interim, they do recognize that adulterated products are causing problems and deaths. And we appreciate the committee's action on this, and we hope the legislature will move quickly. Thank you.
Thank you. All right. Congratulations. Thank you.
Thank
All
you,
right.
committee.
And next we have House Bill 157. We do have some guests here to discuss this provision. If you can just introduce yourselves for the record and proceed. Thank you so much. And we do have a committee sub.
Second.
We have a motion and a second. All in favor of adopting the sub? Aye. Any opposed? Okay, please proceed on the sub.
Thank you, Madam Chair. And committee, thank you for having us today. This bill amends...
Please introduce yourself for the record.
I'm sorry.
No, you're fine.
My name is Bill Wesley from District 91, Estill County. And
I'm Ed Massey, District 66, Greene County. I'm just here for legal support.
First, I'd like to thank all of our representatives and our Speaker Pro Tem for helping us get this bill together. And what this is House Bill 157. It amends KRS 40521 to clarify the grandparent visitation rights, and which is affected by any investigation related to abuse, neglect, dependency of a child, or termination of parental rights of the grandparent's son or daughter who is the father or mother of the child visited by the grandparent, unless the circuit court determines that it is best interest for the child to do so. So in other words, we're trying to keep the relationship with the war that we have on drugs. We're trying to keep a relationship with the grandparents and the child. And so this amendment in this House bill is to keep the visitation rights unless the circuit judge or the circuit court sees that there's something else that should be done.
Motion the bill.
Okay, we have a motion and a second. Do we have any questions? Okay. Seeing none, Madam Secretary, please take the roll.
Representative Bentley?
Yes.
Representative Bowling?
Yes.
Representative Bray?
Explain my vote, please.
Yes.
I just want to thank the sponsor for bringing this forward. Over the summer, I had a constituent reach out to me, and I know where his heart is on this. And, you know, with the chairman there, I know they're trying to do right by our people, so I absolutely vote yes.
Representative Birch? Representative Dotson?
Fine presentation, Representative. Yes.
Thank you.
Representative Elliott? Representative Fleming?
I vote aye because Representative Massey is free today.
Representative Frazier Gordon? Yes. Representative Marzian? Representative Gibbons Prunty?
Yes.
Representative Rayburn? Yes. Representative Raymond? Yes. Representative Riley? Yes. Representative Sharp? Representative Sheldon?
Yes.
Representative Tate?
Yes.
Representative Weber?
Yes.
Representative Westrom? Representative Wilner?
Yes.
Chairwoman Mosier?
Yes. Okay. We have a title amendment that we need to adopt.
Second.
A motion and a second. All in favor?
Aye.
Okay, thank you. So House Bill 157 as amended by Committee Sub 2, and I want to thank Representative Elliott for his work on his piece. Passes with favorable expressions. Same should pass on the House. Thank you so much for your work and your help with this.
Thank you, Madam Chair. And I'd like to thank our bill drafter on this too. Thank you.
Absolutely.
Representatives Bowling and Tate, I believe, have some votes to record.
I would like to cast a yes vote for Senate Bill 8, Senate Bill 56, House HCR 112. Thank you.
Thank you. Representative Bowling, would you like to record some votes? No? Okay. My apologies. All right. Seeing no further business, we are